Hi,
So
Christina. How
excited.
are you doing today?
I'm good. I'm really good. Thank you. Happy to see you.
Yeah, me too. Yeah, we have so much to talk about. So, actually, I have one question that's been coming up for me because I'm kind of noticing stuff happening out there. So, that question is, what do you see trending in ketamine therapy currently? Like, where can you get it and what's happening? What are the offers out there?
Well, there's a few different offers. One of the thing there's let's see. So I'm going to talk about maybe typical, what maybe we should look for, and then atypical that maybe we need to kind of push a little bit of a red flag or mark as with caution. I think we're seeing clinics that provide intramuscular, intravenous, or maybe troches or intranasal forms of ketamine. They're
Mhm.
usually going to have a screening and other strategies to promote safety for the
Yeah,
people.
and can I just interrupt you for a
Yeah,
second? Just for the general
please.
audience out there, for listeners out there, the troches are lozenges that you put under your
Yeah,
tongue and they
thank you.
dissolve slowly. Yeah, and they do have the same effect. It's just a little bit delayed. And yeah, go ahead.
Yeah, and you people say troche or troche. So out in the world, you might hear one or the other. And
Mhm.
yeah, and it just depends on the clinic. And there's also online services that are providing those same lozenges for people.
Hmm.
Um, yeah, so we are seeing that. There are also clinics that have gone through the trials and tribulations of getting insurance coverage for
Hmm.
their patients. So that would be the intranasal form or esketamine. So a person can plan on spending a couple of hours there for that treatment. And those typically do have emotional wellness care or what we would call like wraparound care.
Hmm.
Maybe not necessarily focused on preparation and integration, but they would have some form of psychological support available. And
Hmm.
then there are others that have gotten us to kind of give a little bit of pause where we're seeing ketamine become available in Botox clinics, salons, where people can go in and just get different the different forms of ketamine. And that is of great concern because there's no screening, there's no medical evaluation or follow-up, and most of all, there's no concern for preparation or integration.
Okay, I have to stop you right there. Like, I am totally weirded out by this. So you can go to a skincare clinic and get a Botox injection in whatever part of your body that you need it or want it. And you can get a ketamine treatment during the same visit.
You can go in, you can get a facial, a Botox treatment, and you can get a ketamine treatment all in one. Hopefully, you don't drive yourself home after that. But
Oh my God.
yeah, yeah. And we discovered today that there is something also called a journey lounge those are places where people can go and journey. Sounds almost like a kava bar, except
Huh.
it's it's ketamine, and you go and you lounge in their immersive experiences where maybe you can watch something on the TV, but there's no wraparound care there, so there's a high potential for emotional problems or physical issues.
Yeah, I mean, just imagine that's like I don't know, doing LSD and watching a horror movie and having everything seem like 5 times as intense. Or, I mean, that just doesn't strike me as being safe. Like, that's
Um,
like take a ketamine shot by yourself and watch TV.
yeah, when we really want to watch when we're using ketamine or any other psychedelic, it's really important. I think this isn't talked about enough. It's like we need to watch the inputs that we're getting, that
Yeah.
our brain is getting, right? It needs to be a calm. I mean, we talk about set and setting, right? But we also want to watch what information we're putting into our body, our nervous system. hopefully we're using ketamine for healing. So let's not go backwards with the healing by creating a nervous system response that is overwhelming.
Yeah, yeah. It all strikes me as like business oriented and really not
Yeah,
taking the actual impact of the medicine seriously.
that's a good point. That's a really good point.
Yeah.
Yes.
I mean,
Yeah, that's a
like
very good point.
imagine you go for your petty and ketamine package. Like that's
Yeah,
insane.
it's disconcerting. And so, what if, well, let's talk this through for a second. What if you are, I live in this world, I'm a middle-aged mom, and I'm
Uh-huh.
surrounded by middle-aged moms who all have very furrowed brows and they are living their lives
Right.
on the life treadmill. Yet the only emotion they live with is frustration, right? And so it makes
Yeah,
sense
like
that
the
they're
more
looking for
children, the more
Botox.
furrows, right? I'm sorry.
Oh yeah,
Saying, yeah,
yeah. You
yeah.
yeah, and they're sure looking for Botox. I mean, I live in Florida, so they sit in the bushes and wait for you to walk by so they can inject you with Botox. That's everywhere. Like the it's if it's just part of our culture
At
is
least
you've
it's
got to have
close by.
big lip. Yes, it's everywhere. Oh, I was getting a massage the other day, and as the lady's standing on my back giving me a massage with her knees,
Uh-huh.
she says, "By the way, I do Botox and filler." Anyway,
And you're like,
off
does that mean
topic.
that you're not going to get off me until I agree for you to give me that shot? Like, what?
I
Yikes.
mean, next. Anyway, sorry. I know maybe we're going off topic, but anyway, the point is it's not something we want to treat lightly. We are influencing and acting upon the brain. Okay, and
Yeah.
ketamine is a medicine that can be used to heal. And for all those moms out there that I see, I really want them to know that there might be something in there that can get healed. Like so that they can live their life without the furrowed brow and without feeling like they're on this horrible life treadmill. But the answer is not taking ketamine as an escape. The answer is taking ketamine as a way to access your own inner healer. And that's really important. And that's lost, I think, when we try to do it like the Botox ketamine combo.
Yeah, that's a really well put point. I mean, ketamine is a serious and really impactful, powerful medicine that is
Mhm.
popular because doctors and psychiatrists have discovered that it actually allows for altered states of consciousness. It opens up neuroplasticity. It brings beautiful potential for psychological work, for inner work. And
Yeah,
like we can all benefit hugely from it, but the maximum benefit, in my understanding, comes from ketamine when we do it in a structured process, right?
yeah,
When you have a clinic to go to where somebody prepares you, somebody asks you what your intention is, what's happening with you, why you're seeking ketamine, what other medications are you on, all this kind of stuff. Like it's an
yeah,
intake process. And then
yeah,
after the ketamine, you take ketamine and you may have any number of experiences that is really about that your brain is reacting to it and shifting. You may have images that come up for you. Your body may feel lighter and you may feel a little bit separated from your body. Like it's a real thing that happens to you. It's not
mm,
just like taking a pill
no,
and not feeling anything and then noticing later that like, oh, my pain went away. Right? Like ketamine
yeah,
is it's a therapeutic, psychologically based drug that has an effect on your brain. So having the post-treatment piece of some kind of psychotherapy or coaching by somebody who's trained in psychedelic coaching
yeah,
so that you can take advantage of what it does
yes,
to your brain, that's where the healing comes in, right?
it is. Um, it's a huge piece of it. And I would even back up and say part of the problem of what we're seeing in the world is we're treating you know, a lot of our life events the same way we treat picking up dinner at a McDonald's.
Mm,
And I think that that is also contributing to the amount of psychological distress that we're all feeling.
mm.
So we need to take a step back and pause. We don't want to treat ketamine like it's an SSRI that you just take in the morning with breakfast and move through your day and wait
Yeah, and
to
SSRI, you
be,
mean like an antidepressant pill,
sorry,
right?
yeah, an
Okay.
antidepressant. Yeah, sorry.
Uh-huh.
Yeah. And also the using ketamine, even if you're, say, taking a low dose ketamine, there is something to be said for sitting and trying to find a moment of peace in your day with your medicine, taking the time to journal, taking the time to talk to a coach or another clinician that can help so that life can begin to feel a little bit more peaceful, a little
Yeah.
bit more manageable.
Yeah. Yeah. This is the
Yeah.
whole point. The point is that we can feel
Yeah.
better.
Better, better. Yeah.
We can
Yeah,
feel
we don't
better.
want to treat it like a Big Mac, that we're grabbing and going and just
Yeah.
getting through it. We
And it,
really need to take the time.
yeah, it's not like a craving. It's not like saying,
Mm.
"Oh, I really need a hit, so
Yeah.
I'm gonna have
Mm-mm.
ketamine at 3 and then at 5 o'clock I'm gonna go, shopping." Like, no.
No.
This is not what brings the benefit to us. Okay, this is so interesting. Thank you so much. I didn't realize the extent to which this is like available at spas, and God knows what injecting what the combination of Botox and ketamine in your system at the same time means for you, for someone, right? Physiologically, like
Yeah.
I don't know how to begin to think about that. But yeah, super
I don't
interesting.
either. I don't either. But then the question, that statement right there, I know we're wrapping up, but that statement makes me think about the way that we treat our bodies and the way that we connect with our body,
Yeah.
and using any of the medicines without consciousness around it, like, and
Yeah.
all of that also what you just said also points to how we seem to want to wrestle everything into submission, like, we want to force things to be different, like our wrinkles or our anxiety.
Right. Yeah. We're not
And
allowed
it's
to age and we don't want to feel anxiety.
Yeah. And we've got to kind of move through these processes with a little bit of ease and peace and connection within and connection with the body. And as long as we keep pushing it out, we're gonna continue to have problems.
Yeah. So, okay. Here's to peace
Okay.
and ease and
Peace.
wellness. Thank you
Yeah.
so much. Yeah.
Peace and ease and wellness. Let's do it.
Yeah.